Salim, what is diabetes to the uninitiated, those who do not know?
So, diabetes is a condition where your body is not able to control your sugar levels. So you have a system in your body that controls the amount of sugar that's circulating in your blood. And that includes some hormones that are produced from the pancreas, that's the insulin. And there are, where the insulin works, so that's in muscles or fat cells or whatever, there are receptors there where the insulin goes to bind to actually get the cells to take in the sugars away from blood. And in cases of diabetes, you have a defect either in the production of insulin, and that's type 1 diabetes, or you have now a problem in terms of now decoding of the message once the insulin binds onto the receptors. So that's defective as well, and that's type 2 diabetes. Now type 1 diabetes happens frequently in the young, so I think probably that's what your nephew has, and it's a condition. It might start. It's one of those things that we're not exactly sure what causes it. Not all the time. So we know there are genetic factors, but we know that there are sometimes viral triggers. So you might acquire a viral infection that causes some sort of pancreatitis and damages the cells that produce insulin in your pancreas. There are some autoantibodies that are also involved. These are antibodies that will end up fighting your own body cells. And once you have those cells that produce insulin destroyed, then you no longer are able to produce insulin, and you cannot control your sugars. And the effect of that is sugars. This is how I tell my patients, think of sugars as oxygen is to iron. So when you expose iron to water and oxygen, you're going to get the iron to rust. So when you're not able to control your sugars and your sugars remain persistently high in your body organs are going to start to rust, so to say. So you're going to have that happening to your kidneys, and over time you're going to develop kidney failure. Something similar might happen to your nerves, your blood vessels, including the blood vessels supplying your heart and your brain, and eventually it speeds up the process of developing of blockages in your blood vessels, eventually leading to, increasing your chances of developing heart attacks or stroke. So that again in type 1. In type 2, which is now the problem where is in the receptors, is in the peripheries. That happens mostly in the older group, and risk factors. I think it's one of the things that we probably hear or associate what doctors tell us. So the obese guy who eats junk food and doesn't exercise much, that's the one who has the risk factor of developing type 2 diabetes, where now the peripheral cells are resistant and they're not able to really get the message of what insulin is trying to tell them. So they're not able to get sugars out from the blood into the cells, and the sugars also remain high. The complications remain the same. And right now, globally, it's cardiovascular diseases, which now include the group of diabetes, remains the number one cause of death. So it's one of the things that I think WHO or the healthcare community, the global healthcare community, is really having, a challenge with. And I think it's the essence of having the World Diabetes Day, so that we can have everyone talk about diabetes as we're doing right now, so that we can increase the awareness.
Okay.
So that people can be able to learn, control, and learn to live with it as well.
All right. I still wanted. I want us to look at type 1 diabetes, which you say it's common among kids.
Yeah.
Yeah. You've also mentioned that it's genetic.
Yeah. There is a genetic component, but it's not always genetic.
It's not always genetic.
Yeah.
So when it comes to a child, how how does that happen? How does a child end up having diabetes?
So with type 1 diabetes, we have conditions in healthcare where we are very much helpless, even us. So type 1 falls into that bracket where, in type 2 we can tell you, exercise, maybe eat healthy, and you're not going to get, or you can reverse type 2 diabetes. But we can't say that with type 1 diabetes. There isn't much that we can do. If you do carry the genetic component, that's unlucky. That's something you got from your parents. And once you do acquire viral infection, viral infections are one of the hardest to actually prevent, and you never know the particular virus that's actually going to cause a pancreatitis that's going to get you to develop autoantibodies. So it's quite tricky. It's difficult to really be able to stop or prevent it.
And for type 2, so this is now lifestyle.
Yeah, type 2 is lifestyle.
What does one need to do in terms of, because you mentioned the older generation. We have youths listening, and we tend to assume that diabetes affects the older people more. We hear you say, "Oh, my mom had this, my dad has this," and we're just ignorant to that fact. How would my lifestyle now affect me later on if I don't take care of it?
So, if you look at the prevalences or the incidences, they are higher, say, past 40. But we do see cases of type 2 diabetes even in late teenagers or even early teenagers and people in their 20s. And most of these who come with type 2 diabetes who get now diagnosed, there is a variant called MODY, maturity onset diabetes of the young, which has genetic predispositions that make you catch type 2 diabetes at a younger age. But more than that, when you find this young boy quite obese and KFC and I'm not against KFC, but junk food, so unhealthy eating behavior. And I think the essence of this is maybe we haven't had that long. So from the evolutionary perspective, we have come in less now, maybe in about 20 years or less. But even prior to that, if you look at our grandfathers and our grandmothers, they never had abundance of food as we do right now. So these things normally take years and generations, for our body to, adapt to all this. Maybe in another 100 or 200 years, we might be able to do all this without any problem. But right now, it's this rapid change where now we have this so much calories at our disposal, and and it's delicious and all that, and we love it, and it all goes into our fat reserves, and we get big and bigger, and that takes you down. So the idea is to really just try and observe your eating habits, maybe try and be a little bit healthier, maybe exercise a little bit more, and avoid other unhealthy lifestyles that can predispose you to some of these complications, include drug habits like alcohol and smoking as well.
What types of food should we eat?
So the best, in the healthcare community, it is said that the Mediterranean diet is the best diet. I managed to meet some guys from the Mediterranean area and ask them what that entails. And basically, it's a diet rich in fish. So you can see fish is white meat, it's lean meat with not as much fat. But more than that, the problem is carbohydrates. So the problem with diabetes is sugars. If you want to control your sugars, really, you just need to control your carbs, your intake of carbs. So your carbs include now your fries, your rice, your chapati, your bread, your ugali, and such. So those are the things you want to be careful when you actually do have diabetes. That's what we advise you to either minimize or even, maybe not take any of that. So we advise our patients with diabetes to increase their protein intake and vegetables intake. And there is a confusion around fruits.
Yeah.
Fruits also have high sugar content. So again, in moderation, you can't do, let's say, a whole half of a watermelon. That's just going to spike your sugars. Yeah.
You know the people who say that when it comes to sugar, there's the natural sugar that we get from the fruits, and then now there's the one that we add. Yeah. So some people say, from the sugar from fruits is actually okay.
But sugar comes from sugar cane as well, right?
So that one now is a processed,
natural
processed sugar.
I think that's wrong.
Okay.
So again, too much of anything is harmful. So the sugars in the fruits as well will be harmful if you overdo it. There is some TikTok accounts, I don't know if you've come across them, and I've shared some of these with my patients, of people with diabetes that actually have, so there is this thing called a continuous glucose monitor that you can fix in, that in real time checks your sugar levels. And they do sort of experiments where, as a TikTok, so they would eat a food and then they would show the chart as how their sugars behaved after that. And all fruits are culprits. You have more than one apple, your sugars are gonna spike. Yeah. So again, just be controlled in all these things.
An apple a day.
Yes.
Please don't keep us away.
Now
you can have two, please.
Yeah.
Okay.
Okay. We're creating awareness around it. What you need to know. In studio is Dr. Salim Abubakar from Premier Hospital. Now, when I came to Mombasa, I think this is my 4th month. Yeah. And I walk around, and every time you want to order something, unaweza kuna nini? Kuna viazi, kuna chips, kuna nini, it's all that, all that food. There's
kuna
zege.
Food. Do you know zege?
Zege ni gani?
Ni chips mayai.
Chips na mayai. Kuna ingine niliona inaitwa mkorogo. Oh my goodness.
Alafu kuna nyingine inaitwa nini? Shawarma mayai.
Yes.
Shawarma chips shawarma.
But viazi karai is popular in the coastal region. How does that harm a person, especially if you consume it frequently?
So the prevalence of diabetes in coast is quite high, and if I'm not wrong, I might have that discussion, or there was a study that had looked at even you look at Awaru in central area, and compared to now the prevalence of diabetes also in that area, and even prevalence of obesity. So potatoes are rich in carbs, and problem with carbs is, you are going to exceed your daily calorie requirement, and once you get to that point, your body is just going to put all these extra carbs as stores, and that is fat in the form of fat. So you're going to become fat. So as someone who's not diabetic, regular consumption of now viazi karai or these other habits that we do, which are basically just a lot of carbs in whatever we do, is just going to get us to a point where we are obese, and that's that spectrum where now you end up being diabetic. For the diabetic, most of them would know by that point that carbs are just going to raise your sugars, and you need to control that.
Okay, now let's look at treatment for diabetes. How is it done?
So for type 1, you have to get the insulin. So you're deficient in insulin, and the only way so far we have as insulin formulations is we have to deliver it as an injectable. So we have different formulations of insulin. We have rapid acting insulins, we have intermediate acting insulins, and we have long acting insulins. So again, this was trying to just mimic the way the body works. So you'll see that type 1 diabetics are advised to do a basal bolus regimen where you inject once per day a long acting insulin that stays in your body for about 24 hours, and then maybe 30 minutes before a meal you do now the rapid acting. Again, some of them will be taught how much of the rapid acting they're going to inject based on the estimate carbs that they're going to be eating at that particular time. For type 2 diabetics, most of the medications that they are put on, that they're started on, are orals, meaning that in tablet forms. And unless it's advanced or you have these other formulations like the GLP-1 agonists, these are also in form of injections. And GLP-1 agonists, they've made a lot of airtime recently with their weight loss effects. I don't know if you've heard of Wegovy or they are the in thing where people who are trying to lose weight, they actually use these GLP-1 agonists. So initially they were made for the treatment of diabetes, but then they were found to have this marked weight loss effect. So these come in injectable forms, but most of the medications are oral in form of tablets, and most of them are safe. They come with a lot of other added benefits as well. If you look at metformin is one of the oldest medication for diabetes. It's almost, you can say it's very, very safe with very minimal side effects. Without causing hypoglycemia, you're not worried about sugar levels going down. It has antioxidant effects, it has weight loss effects. So you actually, while you're on the medication, you're able to actually lose weight and get to a healthier version of yourself. Other medications like now what we call SGLT2, those ones are wonder drugs. Studies have shown that patients on SGLT2 do not or have much less problems with the heart, kidneys, and even strokes compared to patients who are diabetic patients who are not on the treatment. So these medications are available, they're affordable, and compliance is the main thing. They come with a lot of benefits. They can help you control your sugars in addition to prolong your life.
All right. I have a voice note here. Let's listen to what he's saying. Good morning.
What is the best diet to prevent diabetes?
He's speaking about the best diet. We have answered that. Yes, I believe Dr. Salim has answered that. But also, when it gets to, so I'm looking at the document here. When a person with diabetes develops kidney failure, that happens.
So I think we had looked at one of the complications. We looked at losing your limbs. So that can happen. So injury to nerves, losing your limbs. Other complications include stroke. So you being diabetic, you increase your chance of having stroke. So we really don't like this as a society. If you look at it in its entirety, we've invested in you. We've continued to go to school. You've done your degrees and all that, and now say you are the manager in an institution, and you get diabetes, and what that happens is your lifespan becomes short because of the diabetes, and we lose you in your 50s at your prime, when you're supposed to give back to society. So in essence, the reason why we're trying to treat you, getting you to control your sugars, is so that you don't get these complications. We don't want you having one side of your body paralyzed, having stroke. We don't want you having a heart attack where now you have to live. Either if you survive the heart attack, you have to live with heart failure. Heart failure means you can't climb stairs, you can't walk a few blocks without getting quite tired. And if it's severe, you can't even sleep flat. So that's not very pleasant. And another very common complication as well is damage to the kidneys. And if you look at patients on dialysis, probably I'm pretty sure the number one cause of kidney failure in the patients on dialysis is uncontrolled diabetes. So, and you really don't want to get there where now you are dependent on the machine to clean your blood, and you have to do it 2 or 3 times every week.
Okay. Dr. Salim, parting shot as we wrap up, what would you tell somebody who's listening in right now?
I hope you've learned from what we are trying to do, what Swahili Pot is trying to do with Premier Hospital, just trying to raise awareness about diabetes. I hope you're going to, control, maybe embrace a healthier lifestyle, healthier food, and you're not going to get diabetes. But if you do get diabetes, it's what we are trained for. It's what we do. We are here to help you. Diabetes care is holistic, where we are not just going to help you control your sugars, but the whole institution of how your family is going to be part of it, but part of your journey. So even in terms of the mental health implications, any complications that can happen, we are there for you.
All right. And where is Premier Hospital located?
Premier Hospital, past the bridge. That's the top hospital on that side. You leave past the bridge. That's where you want to go.
All right. Thank you so much. We have been speaking to Dr. Salim Abubakar from Premier Hospital. And also, it might just interest you to know that Premier Hospital is announcing that Social Health Authority members requiring dialysis are now welcome. So they provide high quality dialysis care alongside personalized treatment plans to support their patients' journey to better health. And so they're encouraging individuals with diabetes or those requiring renal care to visit Premier Hospital and get checked for personalized support. So umesikia, nenda pale utibiwe.